Hey, good evening. How are you? I hope you can hear me okay. My wife, my lovely mia esposa, Karen, is driving right now. I am not driving, so I am talking to you. Hopefully you can see me okay. See if I turn the other light on, that helps. Makes it hard for her to drive. Anyway, I just got done doing a lecture on stem cell therapy. And I love doing those lectures. I really like talking to people about ways that they can get their body to heal on its own, because that's really what we're talking about. We talk about stem cell therapy, but there's stuff that I don't get to talk about at the lecture just because I talk too much as it is when I'm giving a lecture, and it goes on and on and on, and I have to, sorry, it's bumpy here. It's jostling all around. I have to kind of sometimes keep it shorter than I'd like to, and I wanted to give some more information. So I want you all to know that some of the latest research on stem cell therapy is not actually what the actual stem cells do, but what the other factors are that come along with the stem cells and what they do. So when you get a stem cell injection, if you're going to use adult stem cells from a placental tissue, from cord blood, from Wharton's jelly, which is a part of the umbilical cord. If you're going to use stem cells from those types of things, which Wharton's jelly has the highest percentage or highest amount per unit of mesenchymal or adult stem cells of anything that science knows of right now. So an amazing way to get stem cells is through Wharton's jelly. But what they found is if you're going to use adult stem cells from placental or cord blood or cord tissue, an interesting thing about it is that it is the other things that go along with the stem cell that have tremendous impact on the healing. So there's things called cytokines, which are little chemical messengers, which actually help direct your immune system on healing. There are growth factors. We need your body to heal. We need your body to grow. We need to grow new tissue. You want those stem cells to replicate. You want them to turn into new tissue. And those growth factors are really, really, really important. And those have been shown to be extremely effective and just an incredible component to stem cell therapy that is not usually talked about when we're talking about stem cells. Everybody wants to know about the cells themselves, but the other things that go along with it are actually even as important or more important than the actual stem cells themselves. And then you have, so we talked about growth factors, the cytokines. There's hyaluronic acid. Hyaluronic acid is a naturally occurring substance that helps your cartilage regenerate. Lots of women know about hyaluronic acid now because it's used in cosmetic products for anti-aging. Hyaluronic acid has been used for years as a joint fluid therapy approved by the FDA for knee and osteoarthritis of the knees. With Wharton's jelly and and cord blood and amniotic tissue, that some of those tissues are loaded with hyaluronic acid, which is extremely helpful in the healing process. And then with Wharton's jelly and with the amniotic tissue, not so much cord blood, but the cord tissue and the placental tissue is also loaded with tissue scaffolding, like the little particles that are needed for the tissue, for the cells to adhere to have something for those stem cells to grow and make new cartilage and tendon and ligaments out of. So when you're talking about doing stem cells, it is oftentimes a lot of the relief that someone gets early on is from those factors and not the stem cells themselves. And that's pretty cool because the tissues that we use in our office and tissues that a lot of clinics use around the country have those things in it. And Ted, don't have my glasses on here. Ted, let me see if I can read this. Can stem cells help with lung issues? Incredibly, COPD has responded very well to that. Fibrocystic lung disease, we've had a few patients with asthma that we've seen that have done real well. So yes, stem cells have been able to help with lots of lung issues, including some of these things that are generally untreatable, like COPD. Interestingly enough, IV stem cells, getting stem cells done through IV, as the way your blood flows, it flows from your veins and then it goes, what they call first pass is through your lungs. So when you do stem cells with IV, stem cells can actually end up in your lungs very easily and help promote healing in that area. So it can be really fantastic for that. Now, I do want to say this. We do not treat, no one is allowed to say they treat lung issues or any disease with stem cells. They're not allowed to say they treat those things just because of the way the FDA words those things. You can't treat things with human tissue. The FDA says you're only allowed to treat things with drugs. So we are not going to, just want to clarify that. We gotta, even though not a big fan of the FDA, at least want to make sure we continue to be able to practice. So I don't remember where I was, but I hope you guys found this helpful. Share this with friends and family members. If we can help you in any way, we would love to. You can give our office a call. The numbers here on Facebook, on Magnolia Medical Center Facebook page. We love coming and giving you good information about health and well-being. Your body is meant to heal. There's no doctor that can actually heal you in any way. They might be able to sew you up, and they might be able to help you, and a lot of them do. But it is up to you to heal, and there are ways to get your body to heal faster. So, Ted, you give us a call, and we'll see what we can do to help you. Hopefully you live in the area, but even if you don't, there's planes that fly all over. We're about 20 minutes from the Nashville airport, so we're happy to see if we can help you, and we just kind of need to do an evaluation and check you out. Anyway, I appreciate you guys watching again. Hit that share button, hit those like buttons, give me those little hearts. Appreciate you seeing those things. And if there's anybody that can benefit from this information, the more you share it, the more people can get well on their own instead of resorting to drugs and surgery all the time. Have a great evening. Appreciate you watching, and I'll come at you and give you some great information about health and well-being tomorrow. Take care.